There you go. Thank you, Joy. All right, everybody. Welcome to the July edition of the Advocacy in Action webinar. It's great to have you join us to kind of talk about So Kids Can Move and just one version of the kind of model legislation that is kind of at the heart of this process. So our main objective today, we're going to take a closer look at this model bill and learn about how this initiative really accomplishes its state policy objectives from the kind of legal perspective. For those of you who may not be aware, the So Kids Can Move initiative, it is a state legislative movement to create equitable access to activity-specific O&P and try to get it kind of deemed medically necessary through kind of state-by-state legislative change and kind of bill passage. And here's some pictures I have of our efforts from this year. There's Kyle Stepp and Callaway in New Mexico. We have the folks from the Rocky Mountain Orthotic and Prosthetic Coalition, Jim Kaiser in Illinois, Francois Vanderwatt in Arkansas. And then we have some more pictures from Colorado. I see Shanice Kehoe and Angela Montgomery in there as well. So this, ever since in the last year that we've kind of been working on this initiative, we've had a lot of great momentum moving forward. There was a bill passed in Maine in May of 2022 that provided coverage for activity-specific devices for children. And since then, that kind of started off the movement, and we've had bills passed in Colorado, New Mexico, and Arkansas. And a bill is currently on the governor's desk in Illinois as well. And we're hoping to have that passed in the next couple of weeks, if I'm not mistaken. And besides that, we have bills introduced this year in Minnesota, Indiana, New Hampshire, and New Jersey. So there's quite a lot of bills flying around right now. And we have more than a dozen states interested in getting involved in the coming legislative session. So there's quite a bit of interest in this initiative, and we're hoping that the kind of creating model legislation for each of these states is a big part of that. So the big question is, what is model legislation? Essentially, this is a template bill that advocates can bring to their legislators to communicate their main kind of policy goal and the goal of the initiative. And it also kind of serves as a starting point that legislators can then fit into existing law. So essentially, an advocate can go to a potential bill champion and say, this is an issue that I really care about. Here's a problem that we have in the policy as it currently stands, and here is a potential solution to that policy issue. And it's then the champion kind of takes that bill, they work with bill drafters to fit it to the state's existing statutes, and then it's introduced and hopefully moves to the legislature pretty quickly. Ooh, there you go. So this wouldn't be a discussion of legal documents and legislation without a few disclaimers. So I can start by saying that this model legislation is just one example of the kind of typical provisions or sections that could be included in a bill. And each state's bill is going to be different. That really depends on the political climate in a state, their fiscal situation, the laws that are kind of already in place on the books, and kind of a number of other factors. So this is just one example for kind of a hypothetical state that we're looking at the moment. And also, as this initiative evolves, the model legislation is going to change as well. We've kind of only been putting this together pretty recently as a model. And something that we're learning in this initiative is really how nimble we have to be. how different tactics and strategies have needed to change over the year that we've been doing this. And the model legislation is definitely a part of that. So I can kind of start with the overview of the bill. Its name, its kind of working title as a model is an act to improve access to prosthetic and orthotic care for adults and children with limb loss and limb difference. Now, you may notice that I included adults in this title. During the past year, we kind of started this initiative to provide care for activity-specific devices for children, but we've kind of realized that there's been a lot of interest in expanding this legislation to adults as well. One example is in Colorado, during discussions with Representative David Ortiz, who was the bill champion there, the possibility of this expansion came up and he was all for it. He wanted to be as age inclusive as possible and to just capture as much, coverage as we could in this bill. And so that one was expanded from what was originally a children's only bill to all ages. And the other three bills, the other three bills that have passed through the legislature at this point are also all ages. So we're really kind of taking that and running with it in order to be as inclusive as possible. And as part of that, we're in the process of going through a kind of a branding update. And we're going from so kids can move to so everybody can move. And there's a space between every and body, by the way. We want to really make sure that we're getting the point across that this is for everybody, this is for all ages, and we want to expand coverage for as many people as we possibly can. So I can start with this first section, which is the required coverage. There's going to get into kind of the weeds of the bill language right now, but this first part is all individual and group health insurance policies providing coverage shall include coverage and payment for O&P devices that at a minimum equals the coverage and payment for devices provided under the federal laws and regulations for the aged and disabled pursuant to, and this part right here, this United States Code reference is to Medicare. And this coverage must be provided for a prosthetic or orthotic device determined to be the most appropriate model for medical needs in completing activities of daily living or essential job-related activities. And this first section in paragraph A, this is insurance fairness. For those of you who may not be aware, insurance fairness is kind of a movement that's been taking place in O&P since the early 2000s to require state commercial plans to cover O&P at a level equivalent to Medicare. I believe there's 21 states currently that have insurance fairness on the books. And because of that, essentially, this part of the bill is kind of the foundation of our legislation, where if a state doesn't have insurance fairness on the books, then this bill will implement it. But if it does have insurance fairness, the rest of the bill is kind of an amendment to that insurance fairness. And this is where a lot of the kind of fitting the bill to current state statute comes in, just to make sure that everything aligns with what's already there and what we're trying to accomplish. So paragraph B is, in addition to the coverage of a device required by, the first paragraph, which is the everyday device, a device determined by the enrollee's provider to be fitting the medical needs of the enrollee for physical activities. And that we have a few examples in here, such as running, biking, swimming, strength training, and to maximize enrollee's whole body health and lower and or upper limb function. So this is the so everybody can move kind of section of the bill almost, in terms of coverage at least. And it requires state commercial plans to cover these activity-specific O&P devices and care. And the second or the third part of section 1, which is these paragraphs C, D, and E, these require these plans to cover componentry, repairs and replacements, and to provide instructions on how to use them. So that is the first section. The second section is related to medical necessity and non-discrimination standards for coverage of prosthetics or orthotics. So for section 2, this first paragraph, an individual health plan that's delivered in the state that offers coverage for O&P shall consider these benefits habilitative or rehabilitative benefits for the purposes of state and federal requirements for essential health benefits. So as part of the Affordable Care Act, which was passed during the Obama administration, insurance plans are required to provide a group of categories of care, and these are known as essential health benefits. Each state is kind of given some leeway in how to, or the kind of types and amount of coverage that are provided under these benefits. And this is done through a process called benchmarking, where a state chooses a plan that provides these benefits, and then each plan in the state has to kind of meet that standard or that benchmark. And in this kind of system, O&P is kind of under the category of habilitative or rehabilitative benefits. And this section of the bill really, it ties into the first section by saying that both activity-specific and everyday devices count as these essential health benefits as rehabilitative or habilitative care. And this is important because essentially, if there's coverage beyond EHBs in a plan, then that extra kind of added cost would be paid for by the state. So insurance companies are required to provide payment up to those EHBs. Anything outside of that is the state's responsibility. So by considering both activity-specific and everyday O&P care as an EHB, then that ensures that states don't have to defray this cost. And that's a really big deal for a lot of the kind of fiscally minded legislators. You know, they want to minimize costs. They don't want to pay too much, quote unquote, for care for folks. So when you tell them that the state's not going to have to pay for this extra care, that really incentivizes them to support, and it really aligns with their more kind of fiscally minded beliefs. Paragraph B is with respect to a covered person. Covered benefits include a device if the treating physician determines that it is medically necessary for activities of daily living or performing physical activity. So this essentially says that, you know, if a physician deems it medically necessary, then it must be covered. This is kind of pulled from Colorado's original insurance fairness bill or law, which was passed in the early 2000s. And this is, you know, important because a lot of activity-specific devices are deemed not medically necessary by insurers, and they deny a lot of claims for that reason. So putting this into the bill really makes sure that this coverage is provided in addition to the kind of requirement that's created in the first section of the bill. And so section C, this is really gets to the kind of disability rights portion of the bill. An insurer shall not deny a prosthetic or orthotic benefit for an individual with limb loss or absence that would otherwise be covered for a non-disabled person seeking intervention to perform the same physical activity. So that's a bit of a mouthful, but essentially the example that we use a lot is ACL surgeries. Now, if you play basketball in high school and you injure your ACL, that surgery will typically be covered and you're able to kind of return to playing that sport. However, if you have limb loss or difference and you kind of want to participate in that sport, a lot of times that device that would allow you to do that is not covered. And that's not deemed medically necessary, even though both kind of treatments lead to the same results. And that is, to us, is a big disability rights issue. It should be accessible to everyone to play the sports and participate in the physical activities that they want to. And that was actually something that came out of New Mexico, and we were working with the bill drafters there. We were kind of talking about the issues in the bill to them, and they said, "Oh, this is a huge disability rights issue, and we should include something like that in the language." And so that is where this particular section comes from. And the last part of section 2 is that if coverage is provided, payment shall be made for the replacement of the device or parts of the device without regard to continuous or useful lifetime restrictions. If it's determined that there's been a change in the physiological condition of the patient, a change in the device, or the condition of the device, the repairs would cost more than 60% of replacing the device entirely. And so this is essentially an exemption of O&P from these lifetime restrictions. In many cases, these restrictions are 3 to 5 years typically. And if there is kind of a change in the patient condition or in the device in that time frame, it's very difficult to get a replacement. So allowing for this replacement and repair with the proper documentation, of course, really allows for greater patient access. And this is actually similar to a provision in the Medicare O&P Patient-Centered Care Act that we're championing in Congress right now. That deals with reasonable useful lifetime exemptions for custom orthoses in the Medicare program. And that kind of paragraph E is really helpful for kind of any concerns about spending by legislators, just that making sure that there's proper documentation in place. So these last few sections are kind of the boilerplate that we use in every bill that we've been forwarding so far, with some exceptions. But Section 3 is a reporting requirement. Essentially, carriers that issue health plans that this bill affects have to create a report that includes the number of claims and the total amount of claims required by this coverage. And this data is aggregated and a report is submitted to a committee of the legislature that covers insurance matters. And what this is meant to do is to basically make sure that the bill's working as intended, that claims are being submitted and that they're being approved in the correct ways and that payment is being made. And this is sometimes required by the legislature itself. Aside from the bill, there are some states where any type of kind of insurance mandate is required to have a report issued at certain intervals. And so this section might not be required in every bill, but we have it here just in case as well. And Section 4 basically says that it sets the timeline for implementation of the bill. So it says, every plan that is going to be affected by this law needs to include this coverage by a certain date. And then after that, they're required to continue to do so. And this is where we allow for that implementation timeline, where plans are able to kind of learn about the bill, make the changes that they need to, and then implement them properly. And then it also gives AOPA and our partners a chance to really make sure that patients and providers and insurance companies as well are informed about what the bill does and how to make the most out of it to get the right care that you need and provide the right care to your patients. So that was pretty much a rundown of the bill, or this particular version of the model legislation. We're really excited about being able to have something to provide to legislators, to give them the opportunity to kind of talk with us and figure out what is kind of politically feasible and what can make what has the best odds of succeeding in the legislative process that can provide the most care for patients. And I know that was quite a bit of information, so I'm definitely happy to take any questions y'all may have.
My name is Sheila Trisnadell. Could you hear me okay?
Yep, I can hear you.
Okay, perfect. So I'll introduce myself. I live in Illinois. My daughter is 15 and she's a below the knee amputee on her right leg. I know you just kind of said that Illinois was getting into things more. We actually get our prosthetics out of Tennessee. And currently I have a couple of little questions, but currently I work for a law firm and am wondering, if I can catch up with somebody later, if there's anything we can do to help, I'd be happy to help myself or get law firms involved to help if there's anything needed here. My questions, just to make sure I'm understanding this and what's happening here more, to make sure I didn't misunderstand anything, is does this include all insurances or is this more about the Medicare, Medicaid kind of Affordable Care Act, or is this like for all insurances is my first question.
That's a great question. So this model legislation in particular, it basically covers state regulated commercial plans. So this wouldn't be kind of plans offered through the Affordable Care Act or through Medicare and Medicaid, but we do have some states that are looking to include Medicaid coverage in their legislation. It's definitely important from kind of a health equity and access angle, obviously, but I think there's a few states where there's like a fiscal kind of consideration for that makes it difficult for a bill like that to pass. But we're definitely always willing to look into adding kind of Medicaid provisions to the bill.
So in my job, we do medical health care. And so we work a lot through and with Medicaid and Medicare. So that's why I was kind of asking to that, because I'd like to, if in any way, help with this in any way we can. I do have like a commercial insurance. So like say I have Blue Cross Blue Shield. With this new law, would this be able to help my daughter be able to get, say, a running blade or a swimming leg or different things she's needed that she has not, we have been able to help and accomplish for her, but insurance wise, she has no access to that. And so it'd be interesting, based on what you're saying and some of the wording that's in there. And I understand you're saying every state is different, but would this be helpful? And now in saying and being able to fight, saying no, she's on track. She can have a running leg. She's a swimmer. She can have, what she needs here. Is that what also part of this bill is helping to accomplish?
Yeah, no, I think that it depends on the specific plan, but I think that would especially be affected, I think, by the kind of medical necessity provisions, where if a physician says that, this is medically necessary for her to be involved in an activity that's beneficial for her, mental and physical health, that this would be covered.
I'll also chime in as well. Sheila, great to meet you. My name is Nicole Verkeilen. I'm AOPA's manager of public engagement and work closely with Sam on So Everybody Can Move. I just want to point out that Bukola Bello, along with Lori Johnson that are on the call right now, are both from Illinois, and Bukola was the lobbyist that helped get this bill passed in Illinois this past year. So she would likely be the most intimately involved in the specifics of the legislation itself. And also to that effect, knowing, which commercial plans are covered under this. From my AOPA standpoint, we'd be happy to kind of dig into it further to see if your, specific plan that your child's on is covered under this. But I would also love to add the fact that, to your point, in this model legislation, we're specifically targeting commercial plans, but we have not yet expanded to Medicaid. And that is something that we would absolutely love to bring to Illinois as well. And given your contacts and kind of what you're offering, would love to, develop a relationship and work closely together on that moving forward.
Yeah, and thank you guys for everything, everybody on this call, for what you're doing. It's obviously something that's very personal and important to me. What I can do, if this is helpful, or however you want me to do it, is I can email Sam, since I see his email right here, give him all of my contact information, and I truly would be happy to move forward in working with you in whatever way I could.
That would
That'd
be
be
great.
incredible.
This is Bucola. I wanted to say hi, Sheila. Hi, Sam. Hi, Nicole. Thank you so much for that. I am driving, so it has taken me a little bit of navigation to safely get off mute. But yes, I would love to answer more of your questions and see if there's any additional information that I can provide for you. And then once the bill has actually been signed into law, we are still waiting on word from the administration on when that will happen. Then I'll be able to let you know, and then provide you with information on the effective date, when it will actually be able to be implementable, because that won't be until next year, January 1 of 2024. But most certainly we can talk and connect. Happy to do it, and happy to respond to any emails once I get off the highway.
Thanks,
Wonderful.
Bucola.
Thank you so much.
And drive safely.
I was about to say.
Sheila, I wanted to ask, you mentioned that you have your care done in Illinois, but also Tennessee. Are you guys working with amputee blade runners, or what are you?
Yeah, we're a patient
Okay.
of amputee blade runners. Yes.
Okay, awesome. Great. Yeah, we've connected with Joshua there as well.
It's funny because I was sitting here and I'm like typing all these notes and emailing them to Joshua, so I didn't know if he knew.
Yes, we have been in conversation with him as well. And
Okay.
we've got a group in Tennessee that's getting formed to work on introducing this in Tennessee as well. But to clarify, your specific plan is through Illinois.
That is correct.
Okay.
Couple of questions. You're available?
Yeah, Samantha.
My name is Samantha. I'm in Kentucky, and I'm on the board of a charity that provides prosthetics for adults and children, but we send them to Orlando, Florida. My daughter is an above the knee amputee. So Kentucky doesn't look like it has any interest based on your mapping. One thing I was wondering is, can we get a copy of this PowerPoint? So one of my good friends is a state senator here, and I think this would be helpful if she could see it to get me started. She's very interested in helping me. She's a really great friend of mine. The other, if there's states that have had this bill passed, do we have any access to see that and talk to somebody to see, like, when the bill was passed, what changes were actually saw? Like, I've been compiling information for the past couple of years through the nonprofit I'm with on how much it really takes to transfer these people out of their state to bring their kid to Orlando, Florida, because we pay for their hotel and their flight and their prosthetic. And it's a good amount of money. So I've been kind of keeping up with this just to prove my point as to how much this is costing to just get a kid a running blade. And the changes in their life that it seems like, as far as their mental health improves, as far as their weight improves. I'm a nurse by trade, so like I've been interested in this for quite some time, and just how much it can improve the quality of their life. And then as they transition to an adult, how it affects them as well if they did not have the proper athletic leg. I mean, just like Sheila, I know Sheila from way back. I mean, she travels to Tennessee. I travel to Florida. There's a lot of people that will really invest the time. I'm just wondering what the outcomes have been for the states that have gotten this bill to pass.
Can I jump in real quick? I'm Megan. I am actually the vice president of AOPA, and we are starting to introduce this into Kentucky. And so that is happening. So Samantha, if I can grab your contact info, either if you want to email it to Sam, and then I can be in contact with you, because we are starting to do it in Kentucky.
Okay, so Rachel Roberts is a state senator here, and she's a great friend of mine, and she's all on board with helping out if I can just get her the information to get it started. She just reached out to me again the other day to see what she can do, but I'll send Sam my information, of course.
Awesome. That'd be incredible, and definitely understand those barriers to care, and that's what we're trying to fix here. And I can definitely send you the PowerPoint, send you the bills. The only one that's been kind of implemented so far is Arkansas. I think that was actually a couple weeks ago on July 1st, but we're definitely looking to kind of have an implementation side of this to make sure that it's implemented correctly, that we can know the kind of outcomes that are coming from each bill.
Yeah, and I guess I'm happy. My understanding was this bill was actually opposite, that it was the Medicaid, Medicare that we were looking at, and not the private insurances. So I think maybe I've got hooked up with somebody that also was working on the Medicare, Medicaid side, which would be super helpful. There's just a huge population of people that have Medicaid. So I'm not for sure who's spearheading that, but there is somebody that's working on Medicaid.
Samantha, if you find that out, this is Sheila, email me so that I can also hook up with them with our law firm and see what we can do.
Go back, because I thought that's what this was, and I thought, well, that's great, but what are you going to do with the private insurance companies? So I'll have to dig that out, because there is somebody working on Medicaid.
Samantha, this is Nicole. It's good to hear, kind of connect a voice to the name. We've been connected via text message via Laura Lewis and Callaway. So I'm thinking maybe you're thinking of New Mexico, and I believe
maybe
Kyle
that's it.
is on here as well. New Mexico is working closely with the Medicaid office to get this expanded to Medicaid. They decided, instead of going through a legislative approach, to go through more of a regulatory approach. And honestly, because of Kyle's relationships with the Medicaid directors and office, they were 100% on board to just do this without needing to be legislated to do it. So some states were seeing that they want to include it in the legislation. Others were seeing, for example, maybe in Illinois, that they've already passed, or they will have hopefully enacted this by the time the governor signs it. And then from there can then go towards Medicaid office to introduce it. But that's really exciting too, Megan, Ludwig, to hear that you guys are looking at this in Kentucky as well. That is new information to us. So we definitely want to get you on our list and have you part of our lead advocate calls moving forward as well.
Yeah, that would be awesome. We kind of just started looking into it probably about the end of May after our AOPA meeting. So from here on out, pretty much our main focus is going to be working on a similar bill to introducing to Kentucky.
Amazing. That's great.
Awesome. And I also just put my email in the chat. So Sheila, Samantha, everyone else who, if you have any questions or want to kind of connect, then please feel free to reach out.
Yes, thank you so much. This was great.
No problem. Appreciate it.
Sam, hi, it's Terry. Do we have, hi everyone. Do we have model language for the Medicaid insertion for the bills? I'm really glad that Nicole said that this could potentially be a legislative or a regulatory change depending on the state. In Minnesota, we've been able to change things through Medicaid, actually both ways. So I'm just curious, that is not something we added into our current bill. So does AOPA have model language for that Medicaid piece? Because that's not in our bill. I'm not sure it needs to be, but I'd like to see it if we have it.
At the moment, we don't. I think mostly because state to state Medicaid kind of laws are kind of different. So it'd be tough to create one to fit everything, but I think that's definitely something we can look into for like next steps and kind of the next iteration.
Okay, has anyone done that yet in the legislation that's been passed or proposed?
I think Massachusetts is looking into that right now.
Mm-hmm.
Okay, great.
So we could use them as an example and get whatever they're coming up with, which was kind of something I wanted to share too. And just this process is that all of the states it's kind of like an incubator for policy, in that we're taking little bits and pieces from every state, like what we learned from Illinois or what we've taken from New Mexico and what we'll soon take from Minnesota as well, Terry. It's been amazing to see how each state is adding kind of a new flavor to this and making the legislation better for it. So perhaps we can reach out to Maggie Baumer in Massachusetts and have her share that.
Yeah, well, thanks to Kyle, we've got a great start. Kyle and New Mexico, all of New Mexico, we've got a great start in Minnesota. We actually modeled our bill after New Mexico's. And then we also added the bathing and swim O&P devices. So I didn't see that model legislation in your slide deck. Sam, potentially maybe that's something that could be added. And then if we do get something for Medicaid, maybe that could be added down the road too. But again, Nicole, you're right. This can be done on the Medicaid side, on the regulatory side, and not legislative. And that's, you know, sometimes just a much easier path to take. So
yeah,
thank you.
Yeah, Terry, I was going to share that because that was the most helpful thing that Nicole, Joy, and Sam shared with me is before we attempt to do the legislative, let's have a conversation with the Medicaid team to understand what is their recommendation. Because knowing they're going to give you the best insight in how they can implement it, just knowing within the structure and the powers that they have in order to make decisions or not. And so for states that are considering adding the Medicaid before you make the decision, having a conversation with their team will profoundly impact and guide you towards your process. Because we did not know that until we met with them and they shared with us, hey, because of the bill passing for the commercial plans, we can now implement this and just mirror the coverage for Medicaid. And so I would recommend just starting with the conversation with that team and they can guide you in your specific state.
That sounds great. Thank you.
I think there were a couple questions in the chat. Sean, I know you added one and I wasn't sure if it got answered fully for you or not. But in terms of what insurance plans are in the scope of the model legislations and which ones are not, including ERISA, ACA, Medicaid, Medicare, private commercial plans, etc.
Mm-hmm. Yeah, if you could just go through that list of what the model legislation has and then what things different states are exploring.
Sam, do you want to take that?
Sure. So this is mostly dealing with kind of state regulated commercial plans. So it's not Medicare, Medicaid, or exchange plans or kind of ERISA plans, but for this model legislation at least. But there are a few states that are looking into Medicaid, and I believe, yeah, Indiana's bill was dealing with Medicaid as well, but that one we're working on reintroducing in the next session.
So this is, do you have an estimate of what percentage of individuals this would cover then, if it was just the commercial plans, state commercial plans?
I think that's a good question. I mean, it'll vary state to state, and I think that's something that we've talked about, like trying to determine specifically, because we are definitely aware that it's not 100% of folks that are going to be affected by this bill. And so the kind of, especially in states where there is a high Medicaid population, going that legislative or regulatory route will be a big part of it.
Okay.
Yeah, I think, Sean, to that point, Maggie Baumer had a great suggestion for us, and that we're working towards creating. It would be a map of some sort that you can be able to visualize within each state, like what percentage of the population is covered. Because as you can imagine, like this is kind of a multi-tiered level approach to make sure that we can get 100% covered in every state. And we're going to need the commercial plans, the Medicaid, and then eventually going at this from a federal perspective.
Okay.
Yeah, that's kind of the approach now that we're taking.
Yeah,
but
understand. So if I understand this correctly, commercial plans and Medicaid are controlled by the states?
Yeah, so state commercial plans are, and then Medicaid is a kind of a state federal program, but yeah, it's mostly state controlled.
Okay, and then the things that the federal government exclusively controls would be ERISA, Medicare, and ACA plans, correct? Okay, great. Thank you. That put that framework in my head so I can think through this easily going forward. Appreciate it.
There's a lot of pieces for sure.
Yep. So Sam, I have a question for you. As I think, so we, Kurt and I just met in Wisconsin, so we're trying to get the ball rolling with getting some some advocates and stories. As we go through the whole legislative process, so getting model legislation, trying to talking to regulators, trying to find a sponsor, how do we typically work with you and others on the O&P industry and AOPA to go through that process? If there's changes, questions, like, can you give me a high-level overview of what that could look like, and what are some good resources as we navigate questions and propose changes?
Yeah, sure. At the moment, we're kind of working on a legislative toolkit. Actually, this is going to be a document that outlines the process and hopefully answers questions that may come up during the kind of legislative process and leading up to that. But we're also kind of, at the moment, we're looking into how best to address kind of those one-off questions that folks may have from different states. And we're kind of landing on a kind of a state coach system. So we're still in the earlier stages of that. We're just kind of talking it through right now, but we'd have kind of a point person to assist each state through the process.
Okay. Yeah, sounds great. Looking forward to it. I know you guys are working really hard on putting that tool to get together, and it's a lot to support. Will hopefully be 50 states. Thanks for the update.
Yeah, absolutely. No, yeah, we're moving right along. We're over a dozen states are interested. I'm still trying to get the count right. We still have a lot of folks coming out and showing interest in all over the country. It's been amazing. All right. Does anybody have any other kind of questions, suggestions?
I just want to genuinely thank all of you. This really means a lot. So looking forward to, I already sent you the email, Sam, and looking forward to being able to connect and see what we can do.
Awesome.
So thank you guys.
Sam,
thank
absolutely.
you.
Thank you.
Sam, this is Colleen from the Georgia team. Hi, Nicole.
Hey,
do you're going to record this? I mean, this is recorded, right? Will you send it on? Okay.
Yeah, this should be on our, we put the recordings on our website as well. I'll put the link to that in the chat as well. So it should be uploaded in the near future.
Okay, thank you guys very much. This has been great.
Of course, happy to share. All right, y'all. I appreciate you taking the time to talk with us. I think we're made some great connections after the PowerPoints. This has been really great and moving things right along in the States.
Amazing. Thanks so much, everyone.
Thanks, y'all. Have a good rest of your day.